compare diclofenac versus Celecoxib. Why I'm making this video is that there was a time I went to a pharmacy and the woman complained of that she has been using diclofenac 50 milligram for a pain for a very long time. That she need a stronger and a more potent analgesic. But the pharmacy attendant went and brought Celecoxib because Celecoxib is having about 200 milligram. Yes, it's about 200 milligram, while diclofenac is 50. So thinking that the 200 milligram means that it's more powerful than diclofenac, and we all know that Celecoxib is even more expensive than most diclofenac. If you have not followed me, this is the Celebrity Pharmacologist, and this is your first time of coming across any of my video, please don't forget to drop a comment, like this video, and share it to those people that are into drugs. So let's dive into it. You know that both of them, they are classified as non-steroidal anti-inflammatory agents. That means NSAID, non-steroidal anti-inflammatory drugs. And they work by what? Inhibiting cyclooxygenase 1 and cyclooxygenase 2. That's COX-1 and COX-2. That's the mechanism of action of NSAID generally. Diclofenac works by what? Inhibiting COX-1. That's how it works. It inhibits COX-1 and COX-2. Then Celecoxib, it's mainly acting on cyclooxygenase 2. That's the difference between diclofenac and Celecoxib. Diclofenac inhibits COX-1 and COX-2. The issue here is that COX-1 is not the main enzyme responsible for the pain you are having. Whenever you are having pain, the enzyme that is responsible, that makes you to feel that pain, is the cyclooxygenase 2. So inhibiting COX-1 is kind of useless when we are talking about pain. That's why scientists or pharmacologists have to develop this cyclooxygenase 2 enzyme inhibitors like Celecoxib. They just inhibit what? The cyclooxygenase 2 enzyme. So looking at it now, we'll say that in this comparison, from mechanism of action, Celecoxib is kind of what? Better. But I want you to know that diclofenac is a preferential COX-2 inhibitor. It prefers to inhibit the COX-2 than inhibiting COX-1. What do I mean? For instance, someone that prefers eating ripe plantain and someone that prefers eating, someone does not like eating unripe plantain. So when you keep like 10 ripe plantain and you keep like 20 unripe plantain, this person will first of all eat the 10 ripe plantain or the 5 ripe plantain before going for the unripe plantain. That is what diclofenac does. It prefers to inhibit COX-2 enzyme, which is the main mechanism for pain. So if you are giving Celecoxib 1 mark here, you will give diclofenac 0.5 for preferring to inhibit cyclooxygenase 2. When we talk about their onset of action, for diclofenac is around 30 minutes or 15 minutes to 1 hour. To 1 hour. 30 minutes to 1 hour, you start seeing effect. But for Celecoxib, it has a longer time before you start seeing effect. So let's say roughly 1 hour. Roughly 1 hour for what? For the onset in Celecoxib. So looking at this now, for someone that needs pain to be dropped drastically, you see that diclofenac has won here, while Celecoxib didn't do well. Then we'll talk about half-life. Half-life is just like how long it stays in the body. So for diclofenac, it's around 1 to 2 hours. 1 to 2 hours. Celecoxib is roughly 11 hours also. Roughly 11 hours. So in this area now, diclofenac has failed, while Celecoxib has won. However, because of this, people now take diclofenac like twice daily. That's why you say take 50 milligram 2 times a day, take 75 milligram twice a day, even 100 milligram twice daily. So that one we are not going to grade them, because whatever ways, you see that you can actually help out by taking it 2 times daily, while this one you take it just once a day. Now let's talk about their indication. For acute pain, diclofenac is excellent. It's very good. So we'll give it excellent. Excellent. It's very good for acute pain. However, for Celecoxib, looking at the time of onset and how long it will take before it starts helping out, it will take about 1 hour. So we'll give it, it's okay, it's good for it, it's good, but excellent is better than good, if I'm not mistaken. For dental pain, someone that is complaining of toothache, Diclofenac is also excellent. Excellent. Celecoxib is also good. It's good, but Diclofenac it's winning here. For arthritis, Diclofenac is excellent, but one thing you should know is that arthritis it's a pain that it's not an acute pain. It's an excruciating pain. So Celecoxib is also good for it. Excellent. So these are the place where Diclofenac did not do well. For long-term use and stomach safety, Diclofenac is not a yes here. For long-term use and stomach safety, because long-term use will inhibit the production of prostaglandin and it will reduce the stomach protective lining, which can actually lead to ulcer. However, Celecoxib, which is a preferential COX-2 inhibitor, that is not going to inhibit the COX-1, which is also seen as a what? A housekeeping enzyme, a maintenance enzyme, because this COX-1 is seen as that. So as far as it's not going to affect COX-1, then Celecoxib is preferable for what? A long-term use. But you should know that there are other NSAID like naproxen, which can even do better for people for long-term use. It can even work for people with cardiovascular diseases. But well, we are not going into depth. Now, let me ask a simple question. Like a patient, let me give examples of where diclofenac will be better and when Celecoxib is better. If a patient is having a prolonged or a past history or an history of gastric ulcer or anything that's related to acid reflux, then Celecoxib is better. When you want to use the drug for a long time, you want to manage a pain for a very long time, then Celecoxib is also better. Now, for instance, someone was involved in an accident, you need a potent anti-inflammatory. Please take note. A potent what? Anti or anti-inflammatory drug, a potent anti-inflammatory drug, or and a potent analgesic, because they are both analgesic agents. You need a potent analgesic. Then diclofenac is better because it has a potent anti-inflammatory and a potent analgesic effect. So when you need something so urgent, you need it immediately. This it will do the job better than what Celecoxib. If you find this video helpful, please do well to hit the follow button, like this video and drop a comment. Thank you.